Okay, let's unpack this. Do you ever feel just overwhelmed by all the information flying around, wishing there was maybe a clearer way, a shortcut to really get a handle on complex stuff without all the noise?
Well, that's pretty much what we try to do here on the deep dive. And today we're diving deep, really deep into a fascinating and incredibly promising compound, Ibogaine. This isn't just about some plant. It's potentially about a whole new way of looking at mental health, and especially addiction treatment. It feels like an area that's just ripe for something new.
Yeah, definitely. And we've gone through quite a stack of material for you. A lot of it comes from a recent webinar featuring some, leading voices like Dr. Bruno Rasmussen from
Mm,
Brazil and Brian Hubbard, who's the CEO of Americans for Ibogaine. Our goal here really is to pull out the most important insights. We want to look at Ibogaine's huge potential, sure, but also the big challenges, the obstacles, and the path forward. We want to make sure you walk away feeling genuinely clued in. So we'll be looking at its history, which is pretty surprising, actually, its unique effects, how different places around the world handle it, which is wildly different, and those big questions about actually making it available to people who need it.
right. And, one of the experts in our sources, Dr. Gabor Mate, he says something pretty powerful. He calls the war on drugs cultural schizophrenia.
Mm.
And that really sets the stage, doesn't it, for taking a critical look at how our societies approach addiction. This deep dive should really shed some light on how maybe this one compound could challenge that whole mindset.
Okay, so let's start right at the beginning then. What exactly is Ibogaine, and where does this whole incredible story kick off?
Okay, so ibogaine, it's a compound, a psychoactive one, an indole alkaloid found in certain African plants. The main ones are Tabernathia iboga and also Voacanga africana. And its use isn't new at all. We're talking millennia here, like way back into prehistoric times. It's deeply woven into traditions, holds sacred meaning, especially in things like the Buli religion.
Ah, the Bleedy religion. That part's really interesting. They use it in this pretty intense 3-day ceremony, right? Usually when someone's about 17, as a kind of rite of passage.
Exactly. It's seen as this major transition point. The idea is it helps transform teenagers into adults ready for their place in society. The depth of that traditional use is, yeah, it's quite something.
So how did this ancient practice connect with, like, Western medicine?
Pure chance, almost. It was 1962. An American guy, Howard Lotsoff, who was himself dealing with heroin addiction. He decided to experiment with ibogaine, and he described having this incredibly vivid psychedelic experience. Very introspective, seeing images from his childhood, his teenage years.
Okay, and the really amazing part, the part that changed everything for him.
Within 24 hours of taking it, just one dose. He said his withdrawal symptoms and the cravings, gone, completely stopped.
Wow. So not just like deciding to quit, but a physical.
Yeah, a profound biochemical thing, exactly. It made quitting physically much, much easier. And that experience, understandably, turned Lotsoff into a lifelong activist, pushing for ibogaine research, trying to get it developed.
But despite his efforts back then, it hasn't exactly become mainstream, has it?
No, not at all. It's been a really slow, difficult path, lots of challenges. But people are still working hard today, trying to make it accessible for more people. The effort definitely continues.
Okay, so we know it has this powerful effect on addiction. That seems clear. But the sources we looked at suggest the benefits might go even further. What else are we seeing? What could it mean for others?
Well, clinically speaking, it seems to help patients on two levels with addiction. One is the biochemical part, stopping withdrawals, stopping cravings, which makes quitting physically possible. But there's also this deeper understanding, sometimes subconscious, that the drug use just isn't working for them anymore. And beyond addiction, yeah, there are early signs, indications that it might be helpful for things like depression, maybe even Parkinson's, multiple sclerosis, other conditions too.
Hmm. And linking that to the bigger picture, one expert mentioned deaths of despair. That's a heavy term.
It is. He was talking about the rise in deaths from alcohol-related disease, drug overdose, suicide, tragically increasing, and seeing Ibogaine as a potential therapeutic for that underlying despair, particularly noting the impact on military service members, special operators.
That really broadens the scope, doesn't it? It makes you think about what's really driving some of these issues.
Exactly, and it contrasts sharply with a lot of our current systems. Often, pharmacology just manages symptoms, keeps things kind of level. What's so compelling here, what the experts emphasize, is this idea that Ibogaine might address the whole person. Mind, body, maybe even spirit in a broader sense, offering something genuinely multidimensional, not just symptom control.
That sounds incredibly promising. But okay, let's get real. Powerful medicines always come with risks, right?
Hmm.
What are the actual challenges here? And how do different countries handle something this potent?
The big one, the main medical worry, is cardiac toxicity,
Yeah.
specifically arrhythmia, and that can be life-threatening if it's not managed properly. So the critical question becomes, how do you keep patients safe?
Right. So what's the answer? How do you manage that risk?
Rigorous medical oversight. That's the key takeaway from the experts. Take Brazil, for example, where it's legal. Treatment has to happen in a hospital or a properly equipped clinic, one with immediate access to an ICU, just in case.
Okay, so a serious medical setting.
Absolutely. And prevention is huge. Thorough pretreatment checks, blood tests, EKGs. These identify potential issues before treatment starts so they can be addressed. The experts really stress this is strong medicine. It's not, a drive-through kind of thing.
Yeah, definitely not cash rush.
Patients need proper physical prep, psychological prep too. And then afterwards, a critical observation period, 24 to 48 hours, in a safe, protected place. One expert we looked at, he's treated over 2,500 patients in Brazil following these strict rules. And his record, no deaths, no major complications, which really shows if you do it right, the risks are manageable. That's crucial context. Okay, now let's shift gears a bit and look at the U.S. How does that compare to this situation here? The costs, the outcomes. It's often a very different picture.
It really is. Think about standard opioid addiction treatment covered by, say, Medicaid. You might have a 30-day inpatient stay. That's around, what, $36,000?
Yeah, roughly.
Then often followed by 90 days of intensive outpatient. Another $72,000 maybe?
So you're looking at over $100,000. $108,000 for about 4 months of treatment.
Right. And here's the kicker. The efficacy rate. How often does that investment actually lead to long-term success? It's estimated around 25% compliance.
Only 25%.
Which means 75% of the time, that massive amount of money, it doesn't stick. It doesn't lead to a lasting result. And people often go through that system multiple times. The average is something like 5 times.
5 times, so potentially $500,000 or more per person.
For a system that has effectively a 75% failure rate, when you put the numbers side by side like that.
It's staggering. Just staggering. It really makes you question the fundamentals of how we've been tackling this. Maybe Ibogaine forces that reevaluation.
It certainly throws the economics of conventional treatment into sharp relief, doesn't it? Especially for our listeners familiar with these systems. So given these huge systemic issues, and considering bringing in something powerful like Ibogaine into what some experts pretty bluntly called a broken system, what core values do we absolutely need to hang on to or maybe develop?
Well, one expert really put it starkly. He asked, essentially, are our healthcare systems actually designed to heal people? Or are they maybe unintentionally set up to just manage symptoms in a way that, his words, monetizes misery?
Wow, that's provocative.
He suggested that many systems, especially in substance use and mental health in the U.S., are kind of engineered to keep people in chronic treatment.
That's a tough perspective, but it forces a hard question, doesn't it? Are we aiming for genuine human restoration, or are we somehow, even accidentally, caught in exploiting human vulnerability within these structures? Another expert called Ibogaine a genuine emancipation medication.
Emancipation, yeah. Freeing people not just from the drugs themselves, but maybe also from the side effects, the consequences of long-term conventional pharmacology.
And what about the stigma? That plays a huge role, too.
A massive role. There's this point made that large pharmaceutical companies have often avoided addiction treatments. Why? Because there's this lingering awful bias that sees addicted individuals as somehow second-grade human beings.
That's hard to hear, but probably true in some decision-making circles.
And that bias, among those holding the purse strings or making policy, is seen as a major reason why Ibogaine, despite showing promise way back in '62, still isn't widely approved. It just hammers home the need to treat addiction like any other disease, with basic humanity and respect.
Okay, so if it has this kind of potential, this transformative power, what's the actual plan? How do we get from here to a place where Ibogaine is accessible and, importantly, affordable for the people who desperately need it?
Well, in the U.S., the big hurdle is FDA approval. That's the gateway. No FDA approval, generally no insurance reimbursement.
Right, that's the system.
The hope, or the projection, is maybe a 6-year timeline for that process, possibly faster if it gets breakthrough designation status.
6 years?
But yeah, that raises that difficult ethical question, doesn't it? How many lives could be lost in those 6 years while bureaucracy runs its course?
It's a heavy thought, and contrast that again with Brazil.
Big difference there. Ibogaine is not scheduled. It's not controlled in the same way. Here in the U.S., it's Schedule 1, same category as heroin. That creates enormous barriers for research, for clinical use.
So much simpler in Brazil from a regulatory standpoint.
Considerably. The goal there is to get it formally registered with Anvisa, which is like their FDA. To do that, they need solid research showing high efficacy. And they have shown rates above 70% for crack and cocaine addiction.
That's impressive.
Very. And if they succeed with registration, the ideal outcome would be the government stepping in, buying it, and providing it free, especially for the most vulnerable, like people in the cracklands they mentioned. Plus, because Anvisa and the FDA have a relationship, Brazilian approval could actually help push the U.S. process along.
Okay, and when we talk about using Ibogaine medically, are we talking about people chewing on a root? Or
No, not for medical or research use. It's much more precise than that. It's used as a standardized semi-synthetic medicine. So it's extracted from the plant, then purified in a lab to over 99% purity, all done under strict, good manufacturing practices.
to ensure consistency and safety?
Exactly. Precise dosing is absolutely critical.
And this is where some really cutting-edge stuff comes in, right? Future formulations.
Yeah, it gets pretty fascinating. For FDA approval down the line in the U.S., they're looking at potentially synthesized versions of Ibogaine, maybe even pairing it with other molecules. Why? To create unique chemical signatures, maybe enhance safety.
Like the example of adding magnesium.
Right, to specifically counteract those cardiac risks we talked about. That's one possibility. And even further out, there's research using AI, artificial intelligence, to really take the Ibogaine molecule apart. The goal is to design specialized alkaloids that keep all the good therapeutic stuff but completely eliminate the heart risk. That would be a game changer.
Wow. That's next level. And what about sustainability? If this takes off, we can't just strip Africa of its iboga plants.
Absolutely not. That's a huge ethical and practical concern. The long-term vision involves creating self-contained supply chains, maybe using biotech like programming yeast or algae to produce the alkaloid, biosynthesis.
So lab-grown, essentially.
Basically, yeah. And crucially, that completely avoids harvesting the wild plant, which is culturally vital in West Africa and just wouldn't be sustainable for huge Western demand. And there's a strong emphasis, too, on making sure there's fair, reciprocal cooperation culturally and economically with the West African communities who've held this knowledge for so long.
That seems incredibly important. Okay, so we have the medicine itself, refined, maybe even redesigned. But what about the person taking it? What kind of psychological support, preparation, follow-up is needed? Is the drug enough on its own?
That's a key question the sources really dive into. Can something this powerful really work in isolation? And the answer seems to be a clear no. Ibogaine is consistently described as a psychotherapy facilitator.
Facilitator, meaning it helps the therapy work better.
Exactly. In Brazil, the protocol is quite comprehensive. First, a thorough psychological evaluation. You need to rule out things like active psychosis, which would be a contraindication. Then, patients typically have around 4 psychotherapy sessions before they even get the Ibogaine.
Preparation.
And then, just as importantly, similar follow-up therapy sessions after the Ibogaine experience for integration.
And what really stands out there, what seems non-negotiable?
The commitment to the therapy part. Get this. If a patient refuses the psychotherapy component, treatment is refused.
Really? They won't give them the Ibogaine?
Correct. The strong belief is that the benefits of Ibogaine alone, without that therapeutic integration, might only last a few months. They might fade. So the therapy is seen as the core healing process. Ibogaine is the tool that makes that process deeper, more effective. Kind of like how MDMA is used for PTSD, it facilitates the therapy.
That's a really important distinction. Psychotherapy is the answer. Ibogaine helps you get there.
That's the frame. And that same holistic idea is being pursued hard in the U.S. context, too. Ibogaine might kickstart an incredible healing journey, yes. But for lasting change, you need that long-term support system. Friends, family, sure, but critically trained mental health professionals who actually understand Ibogaine's unique effects and how to help people integrate the experience.
It paints a picture of a much more complete, integrated approach to healing. It's genuinely inspiring. So for people listening now, maybe feeling moved by this, wanting to help somehow, what can they do? What advice did the experts offer?
Yeah, there are definitely ways to get involved. One expert specifically suggested checking out Brian Hubbard's project in the U.S. Americans for Ibogaine. Because of its scale, its ambition, it really needs support. They also mentioned looking into local psychedelic societies or maybe veteran groups. Their work often deals directly with trauma, recovery, Natural intersections there.
And Brian Hubbard himself, he framed it quite powerfully, didn't he? Not just medicine, but
A fabulous unity opportunity, he called it, and an emancipation mission.
emancipation again. Yeah.
He basically put out a call to action, encouraging listeners, encouraging you to become part of this wider movement, a broad, multicultural push to fundamentally change how we as a society deal with these issues.
How does someone practically do that?
Well, he pointed directly to the website, americansforibogaine.org, as a starting point, and also just following key people involved on social media, sharing the information, amplifying the message. The idea is that this grassroots energy can build into a real mass movement, something that can actually influence policy, drive change at the state level, maybe even nationally.
Wow. What a journey we've been on. From ancient rituals to cutting-edge AI exploring Ibogaine, we've touched on its deep roots, its almost unbelievable potential for addiction, but also these broader diseases of despair, and looked at the really complex path it faces to become more accepted, more available.
Yeah, and what really sticks with me is that contrast we discussed.
Mm-hmm.
The huge costs, and often, let's be honest, disappointing results of some current treatments, versus the promise of something genuinely restorative, something that integrates the whole person. That focus on strict medical safety plus essential psychotherapy, it points towards a much more holistic way forward, challenging how things are usually done.
Absolutely. And the idea that this isn't just about developing a new drug, but that it's tied to a social movement, one that's challenging stigma, questioning these deeply embedded systems, that really resonates, doesn't it? It feels like it could shift more than just medical practice, maybe how we view human struggle and healing altogether.
Which kind of leaves us, and you, with a final thought to maybe chew on. In a world that's clearly grappling with rising mental health issues, with addiction crises, what role can this blend ancient wisdom from traditions like the Woody, combined with really advanced modern science, what role should it play? How can they work together to genuinely restore potential, to build more compassionate, more effective ways to care for each other?
That's a perfect place to leave it for reflection. We are so glad you joined us for this deep dive. We really hope this exploration gave you some fresh perspectives, maybe some new insights, and perhaps, like us, maybe a renewed sense of hope for what the future of healing could look like.